right. So, hi, welcome to Nipped and Toxxed. I'm your host, Dr. Ashley Robey, and with me is Dr. Kelly Killeen. Hey, Kelly.
Hi.
So, you and I both have been in practice for some time now, and so we're going to do an episode on unusual requests or unique requests or whatever, however you want to phrase it. But in general, as plastic surgeons, we're trained to solve problems, whether they're aesthetic or reconstructive. And so we're used to typical things like, oh, my face is saggy, or my breasts are too small, or things that I guess seem usual to us. But for every 10 usual requests, or maybe more than that, there are some pretty unique requests. So we wanted to delve into some of those things. I'm sure it's subject to interpretation, right? Some things that I think are unusual or unique, maybe you think are very mundane, ordinary, and vice versa. But ultimately, it's up to the plastic surgeon as to whether or not that's something they are interested in doing or feel comfortable doing. So let's just jump in with some of well, I can start with some of the requests that I've had, but also doing some research, just some unusual requests that kind of pop up throughout the country. One that I don't do, and certainly really isn't part of the forte of a plastic surgeon, would be limb lengthening. So people that are short, I think that movie, do you remember the movie Gattaca with Jude Law, like sometime in the
Yeah.
90s or something, where he impersonates his paralyzed brother, so he has to lengthen his limbs to be tall enough. Anyways, I always think about that when I think about limb lengthening, which is essentially like that, but part of our training is lengthening maybe a jawbone or something like that for someone that
Right.
has micronathia, but
Or
mostly
doing one leg for someone who is born with asymmetry, because that's obviously bad for your spine and your joints.
sure.
But lengthening just to be tall is not as common.
I did a little bit of research because I do see lots of short patients in my practice, not just exclusively, but hey, people come in all different shapes and sizes. And so I always kind of wondered, like, hey, why doesn't this person just get a little bit taller instead of making their boobs slightly bigger? Well, it turns out it's because it's extremely expensive
Right.
to lengthen your femurs. I saw the average cost was around $120,000. And if you want to do both the femurs and the tib fib, so the upper and lower part of the leg, more like 250, which is weird because why would it be more than double? But whatever. Like, why not just 240? Anyways,
Yeah, I mean it's
no
interesting
price,
that
no price break.
yeah, I mean it's for women, we're so used to being judged on things, and most of the female oriented plastic surgery procedures are about meeting society's beauty standards. But height is really one of the main, what is it, height and hairline for men, that's always the joke, the two H's
Mhm.
that men are judged on. And hairlines, we have technology for that now, but height, we really don't have a mainstream option for people to be taller. One of my friends was telling me he was reading something about how they went through dating profiles on one of the apps, and they found
Mhm.
that for men that are shorter than average height, the income that they needed to report making had to be
Ooh.
exponentially higher in order for women to click on the profile. So, men don't get the brunt of the judgment like women do, but they do get some, clearly. And
Fair.
I can see how this would be an area that would be hot.
Yeah. So I don't know how popular it is or isn't. I personally don't know anyone that has had their limbs lengthened. The challenge is, you can't really increase your height if your growth plates have fused. So once you're done with puberty and you have fusion of growth plates of your long bones, like that is what it is. So you can't take medicines to grow taller. So I suppose if it's a problem that you've identified as a teen and you happen to convince your parents that you really need something, maybe perhaps you can,
In
but
this
even then,
I don't know about your community, but in this community here, it is relatively common, but also taboo, that people put their kids on growth hormone to make them taller. Families, especially where the kid's tracking to be on the shorter side. So mostly for male children, but it's obviously an area that I would imagine, once the surgery is less expensive, which it very well may be, as more people start doing it, it probably will be a hot area for people.
but it's still something where they basically cut your bones and they put you in an external fixator. So something kind of rigid around your legs. And you have the two bones that they've cut. And then every day you kind of crank them out and then the bone grows in, you crank them out and the bone grows in, you crank them. So it's a process.
And it's very painful. I had a friend that went through this as a child
You do.
because she was born with a limb that was several inches shorter. And it's
Mhm.
horribly painful. This is not a simple recovery. It's a very long, very painful recovery.
Yeah, but still interesting nonetheless.
Yes,
Okay,
very.
not something a plastic surgeon would classically do, more like orthopedic surgeons. How about extreme waist training? So I have a lot of patients, especially after liposuction, that they read online that, hey, what I need to do is wear I got my fat sucked out. No, I need to wear an extremely, extremely tight corset that's going to give me a little tiny waist. And that's going to be the ticket. Have you had those requests? Or have
I've
you
had
had people?
I've
Go
had
ahead.
people try to do it. I mean, I think that's the dream, right? A surgically created smaller waist is actually relatively difficult because it has to do with your underlying bone structure and not really lipo. You could kind of cheat it a little bit with lipo, but for people that really want that very, I hate this word, but snatched waist,
Mhm.
these waist trainers or even rib removals are becoming more popular.
Yeah, there's a plastic surgeon around me that does them. I don't know that he does them regularly because I don't think it's a super common procedure, but will do them for that exact reason.
Yeah, he pops up on my TikTok every once in a while. I see him.
Yeah, yeah. So yeah, it's like that model Pixie Fox, who I think she's one of the people that wants to look like Barbie or maybe Ariel or Jessica Rabbit. I can't keep track which cartoon or fictional character she wants to be, but yeah. So looking like someone whose waist is super tiny is a kind of unusual request. Some people, so back in, I don't know, would probably be like the 1800s, women would wear those extremely tight corseted garments where it would actually start displacing some of your internal organs. So
Hmm.
it's actually, I've seen where you have crunched up half of your organs up into almost your thoracic space. So it's like kind of impeding on your lungs. And then you've crunched the other half down into your pelvic space just to have this tight waist. And it looks pretty disturbing. And I saw that that can reduce your lung capacity by about 30 to 60%, which is pretty, sounds
Horrible.
suboptimal. Yeah.
Yeah, horrible. Yeah, I mean, I think the thing people always need to remember is that our bodies are built the way they are for a very specific reason, and our rib cages protect very important things and allow very important things to function properly. And if you start screwing with it from a cosmetic standpoint, you're potentially risking not only your, ability to do regular physical stuff like that's enough to reduce your ability to just walk upstairs and whatnot, but
Right.
also when you start removing ribs and displacing organs, your spleen and your liver are protected somewhat. So you are losing some of the natural protection your body has for organs that, if they are harmed, can cause life-threatening bleeding. So I don't know, it just seems like maybe not the best idea in my mind.
And honestly, taking it back to that same actress or whatever she is, I think it almost looks gross. I don't think when I look at some of the befores and afters that I think to myself, oh, wow. I mean, yes, that was an extreme procedure, but wow, they sure do look great. I think, wow, they look cartoonish,
Well, it's not
almost
real. It's not
bizarre.
how a
Yeah,
real person looks. And it's kind of like the opposite of what BBLs do. BBLs create a very dramatic waist hip ratio, but they do it differently. They make the waist as small as the body will allow by over liposuctioning, and then they put tons of fat into the butt and hips to make that dimension larger. So they
right.
give you the appearance without necessarily altering your lung capacity and rib structure.
As wild as that is, it seems a little more reasonable. Again, I don't think that going for grotesque proportions should be anyone's uh, goal. You want it to look natural and good. Like, sure, curvy is one thing, but grotesquely small waist and or huge buttocks doesn't sound great. Plus, there's some trendiness in these things where what is popular at one point, maybe 5, 10 years down the road, isn't as popular. And I think that, we've already seen some of that. Like, I don't think people want to be quite as big now as they did perhaps 5+ years ago.
Oh, absolutely. I mean, even in breast, look at what people want now for breast augmentations and breast procedures compared to 20 years ago.
Yeah,
We don't see people putting in 600, 700 cc implants, and that was most of what people did in the 90s and early 2000s. So
right.
it's
It's
a very
what we will
different.
always coined it, like the Texas Roadhouse saloon look. Was that one of our? It's like just the giant saggy breasts.
just enormous. But yeah, I mean, a lot of the implant removals that we're doing these days are patients with just enormous implants that would never have an implant placed that large now.
No, I mean, it's interesting. I don't know why people would want breasts that big. I mean, there's a lot of people that are getting breast reduction specifically to alleviate the discomfort and looks associated with huge breasts. So to do it intentionally, I don't know. It's probably, again, they think it sounds like a good idea, but then 10 to 15 years down the road, maybe they're changing their mind. Yeah. How about the Fox eye lift? Have you had anyone ask you for that?
I mean, I don't do a lot of facial surgery anymore, but I've had patients ask for referrals, and I don't really know anyone in town that is interested in doing that anymore. It was a pretty popular about 3 years ago.
Yep.
And I mean, basically, they're just doing a lateral eyebrow, a brow lift, and they're making
Mhm.
small incisions, or they're doing it with threads, and it looks odd and does not wear well with time. So,
Well, then they're also like raising their lateral canthus, like,
yeah, it doesn't look it looks strange. It's a very odd look. That you can cheat it a little bit with just how you wax and draw your eyebrows on. So I think a lot of people were doing that, which is a better option. Also not the best because as we know, eyebrows don't always grow back when you mess with them. I learned in the 90s, unfortunately. And it's not as popular. I haven't seen anybody to have it reversed yet. So I
mhm.
think luckily it's a procedure that doesn't have the best longevity. So a lot of these patients it falls
Kind of
and
relaxes
yeah.
anyways.
And so
Yeah.
hopefully we won't see too much of that.
No, I haven't. I feel like it's been at least over like a year and a half since I have had someone ask me for that. But yeah, in general, I'm not going for things that are creating like an animal or an alien look.
Yeah, something that doesn't exist in nature. That's always what I tell
Going
people.
for sticking for the human appearance. This one came up under an unusual request, which I don't think is particularly unusual, and that's the umbilicoplasty. So basically, plastic surgery to change the appearance of your belly button. That doesn't seem weird to me at all. One thing I do see a lot is that there are some people that have the classic innie and then some people that have an outie. And with, I would say, rare exception, I think most outies are technically little umbilical hernias.
Yeah, usually so. And depending on the niceness of the general surgeon who fixes them, if they have them fixed, even sometimes people will have them fixed and they won't tack the belly button back down to the abdominal wall. And so they still have a persistent outie even with the hernia repaired. That's a pretty easy fix, yeah. But I see a decent amount of that. I see a lot of people that are stretched out and a little bit loose and their
Mhm.
belly button just looks different and they don't like it. That's actually a relatively difficult problem to solve if they don't have enough skin for a tummy tuck. And
Sure.
also the post tummy tuck belly buttons. People hate their post tummy tuck belly buttons.
I don't see a lot of that. I mean, most people I see postoperatively think their belly button looks better. In addition to having true hernias, I do see a fair amount of what I would describe as pseudo hernias, which you're describing as the, kind of the stretched out tissue, especially patients that have really bad diastasis or all of their skin and all of their underlying connective tissue is really stretched out. Sometimes on exam, it can be really hard to tell the difference between having a true umbilical hernia and just like extreme connective tissue laxity. And you really can't tell until you get in there and are trying to do the repair. But yeah, they often look the same. Patients that have a lot of stretch, and then instead of their belly button being almost like an inverted cone that is a really flat disc, I agree. I feel like those are hard to repair because with an abdominoplasty, you've already interfered with that belly button blood supply to some extent. And so if you get really aggressive and trying to pexy down the center of that belly button down to the fascia, you're just further digging into what blood supply is left. And it can be a little
Right.
bit dicey, a little bit.
Yep.
So most people would rather have a slightly flattened disc shaped alive belly button than a aggressively tethered dead one. So yeah, it's tough.
Yeah, it's an interesting area. Yeah, there's whole online communities of tummy tuck patients who are obsessed with their belly buttons. So yeah, I have a feeling that this is going to become a more popular thing. But I get several DMs a month with people that are mad about, somebody did their tummy tuck and their belly button looks completely what you would expect for tummy tuck, but they have, expectations that it will look a certain way afterwards and want it revised.
What do you think the biggest issue with the photos you've seen is?
Well, I think the main problem with this is just my perception of people is that the main problem with tummy tuck belly buttons is that a lot of these patients have not seen their belly buttons for many years because they have so much laxity. And
Sure.
what they're seeing is just their belly button, and they don't
Mhm.
want their belly button. They want someone else's belly button. And so when they see it, they're like, why doesn't it look like this? And their belly button looks great job. It's just they don't have that person's belly button. And I think you need to be realistic with what anatomy you're starting with. But you know how the internet is. Everybody, decides something isn't ideal and then starts
Sure.
striving for that, even if it's not a great anatomic fit with your body.
Well, what I will say is that I think if I'm being critical of belly buttons post-operatively, what things I don't like are sometimes the belly button stretches out more than you intend it to. And I don't know if that's just the patient's own inherent laxity or the particular surgeon just made too big of a hole. But as a plastic surgeon, when you're making the opening for the belly button, like we actually make like super tiny openings because the tissue is on a lot of stretch and tension. And so a little like millimeter sliver almost immediately stretches out to a centimeter.
Right.
So it doesn't take more than one or two times in your career to realize that, I would say once, hopefully.
Yeah.
Um, but the other thing that patients complain to me is that they'll notice that their belly button is a lot more darkly pigmented than the
Yeah.
rest of their skin.
That frequently happens. It's just PIH. And it can
Um,
get better, but sometimes it does not.
yeah.
Especially darker.
And
I'd say Fitzpatrick 4 and above are the highest risk for.
yeah. Yes, I think especially Hispanic people.
Yeah,
Um,
it's a hard problem. I mean, I've had a few patients who were just driven insane by it that I saw as consults for other things, and we got decent results with just months of hydroquinone to make it fade. But it's can be a very persnickety problem.
Sure. And I don't have a lot of people that are wanting to do skin lightening, but I think it's a combination of one, they haven't really seen their belly button in a long time. And so they don't really know what the color is. And then two, all of a sudden you've kind of transposed different color skin right next to the slightly darker. So it almost exacerbates the problem a little bit. And you see more of like a finite step off from a color
Right.
perspective. But I don't have a lot of people wanting to do skin lightening, although I'm totally would be fine with it. Like, I don't care. You can get all the hydroquinone or kojic acid or whatever you want to put on there to lighten it up. It's fine with me.
Yeah. Go for it. Yeah, I mean, it works well, but it does take time. That's one of the problems with any of the topical lighteners is they don't work in a week, and so it can
Right.
be frustrating for people. But yeah, they work decently in most people if you keep at it.
Well, the other thing I think is not comical, but almost is when patients have an umbilical piercing and you're just not able to mobilize all of that piercing scar off.
Right.
I have patients that are really distraught by the little residual scar, even if it's like this tiny down by the low transverse scar. Like, what is this? Why did you leave that there? Well, like you did it.
Yeah.
You're the one that gave
It's
yourself that
it's
piercing. I
hard,
just
and
couldn't get
if
it
you don't
off.
have the laxity, you don't have the laxity. You don't want to do something unsafe to get, a little tiny scar. And often you can get it out later. If they kind of loosen up a little bit by 6 months, you can get it
You
out
might
then.
be able to,
Yeah.
maybe. I mean, also you could get off at the time if you want to add a vertical tick, but that's not, I would
Not
say
not
I wouldn't do that.
not the preference. Yeah.
Not ideal. Why adding a T-junction and a more prominent scar would not be optimal. Do you guys do tattoo removal? Moving on. Do you do tattoo
Not
removal in
really.
your practice?
We have a Q switch, but we don't do it. We don't like I do it for my patients, but I don't advertise it and do it routinely.
Yeah, I don't either. The only tattoos I remove are ones that are inadvertently removed for like as part of some other
Right.
procedure. And so I don't have patients specifically coming in for tattoo removal requests, but they'll talk about other things, whether it's the breast lift or, a back lift, tummy tuck, whatever. Uh, and they're curious to know whether or not their tattoo could or will be removed. It depends on where it is, but rarely would I be doing a surgery, almost never, to specifically remove a tattoo. It's more of just like collateral damage. Like, okay, yeah, it happens to be in the area of tissue we're removing, or it's partially in the area, so I've just kind of mutilated it a little bit. That happens
Yeah.
a lot too.
Yeah, lower abdominal tattoos are always in the line of fire if you are getting a tummy tuck. I had a patient about 7 or 8 years ago, and I did breast surgery on her. I didn't do any stomach stuff, but she had these three bizarre tattoos or scars around her umbo, and I was like, what was this from? Because they were probably 3 or 4 centimeters long, and she was a very
Mhm.
thin woman. And it was from a tattoo removal from a plastic surgeon. It was the
Cut them out.
she has, I think she said a butterfly or flowers or something, and they were
Mhm.
all around her umbo. And the colors were mostly pinks and purples and blues. And the pink and purple is just very hard to remove. And they had tried for years. She went to multiple places and couldn't get it to be removed enough. And eventually
Really?
a plastic surgeon cut it out. So she had these bizarre scars all around her umbo. And to her, that was preferable to this tattoo she didn't like.
You would think at best it would be a lateral move, right?
Yeah. Yeah, I mean, it was bizarre. The scars were because they were very irregular and strange. And but she was thrilled with it. She said she hated the tattoo and had tried for years to get rid of it and was very happy to have it gone. But I was like, I'm not sure I would have chosen that, but her body, if it brings
Yeah.
her joy, there's nothing unsafe about it.
I once had a patient that was scheduled for a breast lift, and she was coming for her pre-op appointment, which was a couple weeks before the scheduled date. And she had this brand new, like, giant tattoo all across her upper chest,
Oh God.
upper central chest,
Yeah.
huge. And I can't remember what it was, like butterflies, flowers, or whatever it was. And I'm like, oh wow, you just did that before your breast lift. You're gonna like that's gonna your nipples are going right there. Like we're gonna be cutting into that. And um she was so upset that she just canceled her surgery.
Oh wow. She could have
Yeah.
just waited a few weeks and then done it after.
Yeah. Totally nuts. Anyways, yeah, so tattoos. I'm not a fan of tattoos, but I'm sure there are some nice ones somewhere. How about dimpleplasty?
I've had people ask me, I don't do it. I have a friend in my building who does it, so I just send the patients to him.
Oh,
But yeah, I have not had a request for it for years now. It was probably 6 or 7 years ago was the last patient I saw. But there was a time when we would hear people frequently asking about it. It was very popular for a minute in LA, and then it kind of fell out.
yeah. So for those listening or watching, so dimpleplasty is essentially you're making a little kind of tethered scar from the inside of your mouth to the overlying skin to create a little dimple. I haven't had that request, but I have had, I don't know, I don't understand like the piercings that people get here, but like the barbell piercings that people do right here.
Those piercings
Um,
often are not long-term piercings too. It's just a problematic area. It's hard. The dimpleplasty is hard because dimples in life are not visible always. It's just certain facial expressions where you'll see the tethering, but a dimpleplasty, they're always visible. So it's kind of an interesting choice. I think the guy here in town that I send to, I think he does a punch biopsy and then just removes the tissue down below and then sews the skin down to the muscle layer and
Ooh, I
I
don't
know.
like it. Well, so the only
He
one, like
doesn't
I said,
like it either. He doesn't like it either, he told me. So it's
I
just,
don't know why, I don't know why he does it. Well, so I've had patients that have had those piercings that like want to try to get them less tethered.
yeah,
Yeah, not more tethered. So like the opposite of a dimpleplasty. But yeah, once you have a full thickness piercing, like you're going to have a scar in the skin, so that you're always going to have a scar there. Maybe you can release some of the underlying tethering and the indention component, but the scar, it's there.
it's there.
How about this one, elongated ears or nose?
Elongated ears, we hear a lot. The aging ear.
Talking about the gauge earrings.
Well, just aging, because it gets
Oh,
loose and floppy and big as people age. That's a pretty common one. I don't know if you remember, but up in Oregon when we were there, there was a plastic surgeon in town that was kind of her claim to fame. She did tons of those, like little old people with big old earlobes, and she would reduce them.
and
Um,
low plasty.
Yeah, the gauge people, of course. A lot of people, at some point, the gauges are cool, and then at some point they're not, and they take them out and want the earlobe repaired, and that can be a challenging procedure to get the contour right.
Is that trend, do you think, decreasing? Like I never really liked it, so I
The
don't.
gauge, I like piercing, so I don't see it as commonly as I used to, and it certainly seems like when you see people that have stretched their lobes, it's not as significant as what we used to
Have
see.
been. Yeah, I feel like
Yeah,
Portland was a hotbed for big gauge piercings.
yeah,
Um,
that seems very Portland.
yeah, not as much here. And in fact, I know people that are in the military services, they're not allowed to have them.
Oh, really?
So Yeah, so they have to get them, I don't know if it's certain branches, but they have to get it repaired. I've done a handful of patients that were going into armed forces that they said that they had to have it repaired before they could join, which, mm,
Interesting.
yeah, I don't know
Yeah,
what that's about, but I'm like, okay, sure,
we
whatever.
see it off all the time. I have a cute little tool that helps to repair. It's like it holds everything out taut, kind
That
of like
clamp thing?
yeah, that thing's very helpful when you fix them because it keeps it taut so it's not flopping around when you fix it. It
Yeah,
makes
I
a little
have that thing. I don't know. It's kind of okay.
yeah.
So back to people wanting to look like either other celebrities or characters. I actually had a patient that wanted elf ears once, so to make their ear, I don't, their outer helix like more pointy or something.
Yeah.
I didn't.
That's
It
not a
seemed,
common thing. I've never had been asked that. I know that there's a piercing where people will pierce up in the cartilage there and pinch it to try to make it stay. Spoiler alert, it doesn't, and it's just going to erode. It's more of a short-term thing, but yeah, I think you're always in trouble when you're doing things to look kind of outside the norm because it's very rare for people to like that long term. So,
sure.
you know, you have to ask yourself, when I'm 50, 60, am I going to be happy that I've done this to my body? And I think those are always important questions for patients to ask themselves before they take on some of these more niche procedures.
Right, yeah. So having surgeries to make your ears look pointy or bizarre, yeah, I don't do those. But the otoplasties to address protruding ears or overly prominent ears, that would be on the table for sure.
Oh yeah,
Um,
that's
even like little things like where people will have little weird folds on their outer helix where you can see the cartilage. I don't know if you've seen this, almost like a Darwin's tubercle where you can see
yeah,
the little cartilage knot. And then people will ask them if that's a zit because it kind of looks like a whitehead because the skin gets so, it's like such a prominent little point
yeah,
and it almost like blanches the skin permanently. People don't like that either. And that's actually a really easy fix too.
yeah. That's cute. I mean, I haven't been asked that, but that would be an easy thing to fix.
And that one doesn't have the same kind of like age restrictions that a typical otoplasty would. So not that you can't do otoplasties on people that are older, but as we get older, our cartilage gets more calcified and so less amenable to being bent. When babies have overly prominent ears, now they'll just put those little ear molds on them and it will bend right back into shape and you don't even have to have surgery, which is totally awesome just because of all the circulating estrogens. But for kids, if your ears are like this, like it's ideal if you try to get it repaired by age 6 or 7, just because of the calcification of the ears. By the time you're adult, you can still do it. It's just that the recurrence is higher just because the cartilage is just not as flexible. But yeah, like I said, if you just have a tiny little Darwin's tubercle that looks like a pimple, that's not an issue. That's not trying to get cartilage to bend. That's just cutting off a little tiny nubbin and it's easy. So for a while there, I feel like I had a lot of people asking for like a Kardashian type butt, or people would almost always show me noses of certain celebrities, or usually like a model that they wanted to look just like. And the interesting thing is that sometimes people will pick a body part of a supermodel that it's not like their best feature,
Yeah.
but they'll specifically pick it just because the person in general is a really good looking person. And I always found that a little bit curious. Like, just pick, if you want to show me a nose you really like, pick a really good nose, not just like, okay, this is this person who's beautiful and their nose is meh.
Yeah, I think it's hard sometimes for people to piecemeal parts of people. You know, they're used to looking at the big picture and they know that this is a beautiful person, therefore they assume that the nose is beautiful, but it's kind of the combination of features that is what they find beautiful in whoever they're looking at. So I think it can be hard, especially if you're not used to looking critically at any particular feature like we are.
But on the other hand, it just goes to show that, what is this person's expectation, right? Like they want to basically look like a supermodel. Like they haven't really honed in on the specific features or the things that they like about that nose, or in contrast, like what they don't like about theirs. They just want to look like a supermodel, which is a tough thing to pull off.
I mean, don't we all?
Yes, I'm going to sign myself up for that. I just want to go into a little scanning booth and walk out like a supermodel.
I'm a big
Um, Yeah, that would be great. Yeah, so back to, oh, skin color changes. I guess this comes up as a unusual request. I don't have people specifically asking me for this. I know that we've talked already on this episode about potential bleaching agents, hydroquinone. Sometimes a lot of people come in with like dark spots, right? But and that's a
I
common
didn't
area of
want to
treatment.
change skin color, but evening things certainly is a common
Hmm.
they help with discoloration and even their skin tone, whether it's redness or pigmentation. But I've never had a patient ask me about, other than labiaplasty, I've never had a patient ask me about changing the color of their skin.
Oh, you mean because the labia is too dark?
Yeah, that's really common with labiaplasty patients is they don't like that their labia is darker than the surrounding skin.
Hmm. Well, if you do that little, I guess depending on the technique you use, sometimes the lower hanging labia is the darker, and if you
Yeah,
have
sometimes it'll
people
just
do that.
kind of fix itself by the surgery, but other times, they'll kind of invest in doing bleaching agents to try to get the color. And there's even, I don't do it in my practice, but there's even people that will laser the area to try to lighten things.
Yeah. Well, I mean, people will do like perianal bleaching because they don't like the color of their perianal skin. So,
That is
uh,
popular in my geographic area.
yeah, I mean, I just I can't imagine like if you're looking for a partner, like one of your top criteria is perianal skin color. Who cares?
I think like most things, we have hangups that
Wait, hold up. Hold up.
self-induced. That they're insecurities that we have about ourselves. Sometimes the partner said something at one point and it just set something off, but other times, I think a majority of the time in our own heads.
Also, and it's maybe just one of those things that you could actually do something about, right? Where there's other things that, unless
Not
you're going to do a limb lengthening surgery at a cost of $240,000, that wouldn't even be feasible. So maybe it's something like that. The other person I think of is because I know Michael Jackson had a lot of controversies surrounding him about his skin color, and a lot of people purported that he bleached his skin, and supposedly he had vitiligo, which is where you have an autoimmune cause for having hypopigmentation spots. So I don't know his history, but he definitely did look lighter in color in his latter years as compared to his youth. So something was going on.
Yeah, something clearly. Most of his doctors are in my neighborhood. One of them passed away, Arnie Klein guy last year. I'm not sure exactly what he had done, but the common rumor is that he did have vitiligo and that he did have also tip necrosis of his nose, which is why he would wear the mask frequently out so he wouldn't have to deal with any type of prosthetic or makeup or anything. But those are the rumors. I don't know if they're true. Poor guy.
Um, yeah, I mean, I think his nose looked like it was necrosing, like it looked all pinched and irregular. So,
Yeah, I saw him once or twice in my residency walking around, my hood in Los Angeles, and he always had a mask on when I saw him. So,
yeah, that's sad.
yeah.
Okay, how about the 3D body parts? So, I just saw there was this whole article about incels. Do you know that? So, the
Yes.
incels are involuntary celibates.
Yes.
So, it's a group of people who, let's say that they want to be with someone, but they just feel like they're just not good looking enough. They're not as attractive as the Chazes or whatever. I can't remember the name
Yeah.
that they use. Chads? The
Oh,
Chads are
you
the
clearly missed the old Reddit days with the incel board that was banned. That was an interesting place to go look. Those posts were scary.
Oh, Reddit banned the incel board?
Yeah, years ago, before incel even became a mainstream thing, it was a Reddit thing, and they had a
Yeah.
subreddit, and it was wild to observe
Yeah.
them habitat.
What just
Yeah,
people so angry or what?
they're angry and hateful, and they just hate women, and they often hate a lot of other men too.
Hmm.
They blame
Yeah,
everything for their celibacy, lack of sexual activity is everyone else's fault.
right. And so anyways, I saw this article about on these forums, people talking about, okay, well, we can solve this problem by just becoming the Chads ourselves, right? We'll get implants, we'll get fake muscles, we'll get fake cheekbones, we'll get a strong jawbone, and then we'll be the Chads, and then we'll be happy and it'll be so great. But I can't remember where I read this article, but essentially, um, this guy, he flew in from the Netherlands, okay, to have surgery here where in the city where I live, Indianapolis, with this surgeon. And he did something like maybe jaw or cheek or something. and he flew back and it wasn't quite right. So I think he had ended up doing at least 3 round trips from the Netherlands to Indianapolis. I mean, I think he was like worked at a bar, or he was a farmer or something. So it wasn't like he was just rolling in the money, but spent a lot
Right.
of his money on doing this procedure to, I guess, take himself out of the incel category. But essentially at the end of the article, like he tried to kill himself. He still wants to have more surgery. It didn't seem like it was working, was my
Well, I
assessment
mean,
of the situation.
you can only operate for objective things, not subjective. So you can change someone's face, but the problem with incels is that they are incels because of them, not because of their appearance. So changing their appearance will not change that ultimately.
Yeah, and I think that that's one of the challenges in plastic surgery. Like, how do we as plastic surgeons make sure that the reason why the patient is having surgery is a good reason, right? And we try to parse that out, but I don't think that most people would be super forthcoming with really bizarre explanations, right? Like they're not going to say, well, I really want to have this surgery because otherwise I'm probably going to get divorced. Now, those things come up. Like I think I told you once, or I had a patient who was, as she was going off to sleep, was like, I hope this saves my marriage. And I'm like, wait, what? No, like, wake
No,
up. Like,
it's
this
not how
isn't
it's
going
work.
to work.
Yeah.
Like your breasts might look great, but that's not going to save your marriage, right? So when you hear those things, it certainly gives the surgeon pause because having bigger breasts isn't going to save someone's marriage.
Right.
Having a strong jawbone isn't going to make you happy and successful in life. I can say for myself, I don't want to put myself in a situation where the patient feels like they've been promised that, or I haven't delivered on what they are expecting.
Yeah. For sure. I mean, we want our patients to be happy, so it's important to try your best to flush that out before surgery.
So the 3D or implanted person that I see a lot of online is that Justin Jedlicka guy, the human Ken doll. He's the one that has, I don't know, like 30 some odd 3D generated implants. He's got pec implants, quad implants, deltoid implants, base implants. I don't know where all his implants are, but he's got a lot of them.
Yeah, he's famous in my area because he's kind of interacted with every office in town trying to find people to put more implants in him. He kind of burns out one surgeon and moves on to the next is the rumor. I've had a few patients, not him, who have come in with some of these strange implants like biceps or calf or whatever. And they're pretty problematic long term for people. It's a great idea in theory. I think fat grafting has taken over with a lot of those patients with sculpting in muscle, which is also a little bit risky. I don't see it as much, but I mean, they're problematic because they don't often stay where they are supposed to, and they
Mm.
kind of flip and slide and can be bizarre. They also flip over, which looks really
Yeah.
strange as well. And they are firmer than a breast implant, so they're actually quite hard and can
Mhm.
be very uncomfortable for patients.
That's why I don't do or have never done butt implants, just because of that exact reason. Like you are trying to have something that's soft and doesn't move, yet you're sitting on it and applying different vectors of pressure and force to it all the time. I think that it can be really problematic. I haven't seen a lot of great butt implants long term. I feel like they look weird and they get moved around.
They look great right after surgery. I mean, all the befores and afters, people typically will show them like at 6 weeks because they look great right afterwards, but they don't wear very well with time.
Yeah. And I always think of that. Is it Nicki Minaj? I don't remember. I think she has fake butt implants, right?
Oh, there's that famous picture of her sitting on a
Was
chair
cool. Yeah,
stage.
right. Where you
I
can,
don't know what she's had done, but it certainly looks like an implant in that photo. It looks very strange.
it has to be. I mean, it's like it looks like she has implants, and it's like you see this big buttock, and then there's this tiny little skinny leg, like super like a butt, and then way up here is her leg coming out. It doesn't look. It's not real.
Reddit always calls them, which I think is funny, molar butts, because it's like a molar tooth with a little tiny root, so the legs.
Oh yeah.
That's totally now. Like once I heard that, like I can't unsee it. I see people walking around. I'm like, there was a molar butt. It looks like a giant tooth with little tiny roots.
Yeah, it's not a good look. I mean, unfortunately, some people just kind of have that body shape, right? Some people have like a really thick central area, like they're centrally obese, and then they have tiny little toothpick legs. They usually don't have like really big buttocks. I'm thinking more of a big full abdomen and flanks. But
Right. Central obesity or more like the visceral fat type person.
yeah, yeah. And that's a tough look, but also having stick legs with a big butt isn't an upgrade from that specifically.
No, and I think the kind of very scooped out love handle and stomach and abdomen to try to create the waist like augments the look, and it
Mm.
just looks very surgical is what I tell patients. I'm like, some of these things just make you look surgical. People look at you and they know you did something, and if that's your
Sure.
goal, great. But most people don't want to look surgical. They don't want people to look at them and know they had a bunch of stuff done.
Yeah.
Ex-
And also at some point it gets really hard to find clothes, right? Like that's not the type of clothing, those aren't the kinds of proportions that most clothing manufacturers utilize. So you're having to wear extremely stretchy lycra to even fit in anything. Just normal clothes you wouldn't be able to fit into because there's no one that has like a 26-inch waist and then 50-inch hips. It's just not a thing. It's not
Yeah.
really
Well, and
something that,
I don't think people realize you can certainly alter clothing, but it sucks. It's expensive. I mean, sometimes you just want to go to the mall, buy a dress, and wear it that night if you're going to an event. You don't want to have to think that far in advance to have things altered. And it just really changes how you think about clothing yourself. It's like our breast reduction patients is one of the things that they all like practically cry about at 1 month is that they can buy things off the rack and just
Mhm.
like, find things that fit them. Like that is such a blessing if you're not able to do it. And sometimes patients that are starting there and move themselves into this world where it's hard to find clothing that fits them, they don't realize what a nuisance it can be.
Yeah, like and an expensive nuisance, like you said.
Yeah.
That's another thing I always bring up to people who'll come into the office and they're already like a C or D cup and they're wanting to go up multiple cup sizes. And you're like, okay, beyond a triple D, it's going to be really hard to find a bra at a regular store. Probably this.
Clothing fits. I mean, finding a dress that will fit your waist and your chest if you are that large is going to be, and your shoulders is quite challenging.
Hmm. Yeah. Well, so nothing I personally have experienced, but yeah, no, I mean it's obvious. Okay, so how about this? Have you ever had someone request fillers in their feet, like for their heels?
I have not had fillers in the feet. That's interesting. For heel pain?
Mhm.
Oh, that's a good idea. I can see how
Yeah,
that.
I haven't done that either. I've done fillers like in the dorsum of the hand, but just for aesthetics. But I feel like it makes sense to put it if you have heel pain, or certainly I've seen people get like PRP and that kind of thing in certain
Yeah.
joints. I heard of someone who was a hairdresser who was doing a fat transfer elsewhere in their body, and she asked her surgeon to just go ahead and put a couple mLs in her heels, and supposedly it was really helpful. I don't know what the recovery is like for that. I'm assuming that you're not adhering to like don't stand on your
Right.
heels for however many weeks. That doesn't seem reasonable. Maybe you're just walking around on your toes as much as you can. Like, I don't know. But it makes sense adding extra cushion to an area that is deficient. I bet it would feel better. I know we've talked about this one already, but it still came up in my search, and that's the abdominal etching, the fake six-pack muscles. Remember when
Yeah.
Hansen used to do that?
Yeah, I have thoughts about it. I've done a bunch of videos on TikTok. I think it's just one of these procedures that in its best form, it looks great in the right patient, but there's very few patients that are the right patient for this. If you want to go to Hoyo's Instagram and see, he does a lot of it. He's probably the best in the world, I would imagine, at it. I mean, it's really a procedure for very thin, low body fat people who just lack muscle definition because their inscriptions are not as deep genetically as they want. And you could fudge it a little bit. But unfortunately, the people that often get it are people that are a bit,
BMI of like 32.
right, the BMI is a little bit higher. And then you look, it's just like we were talking about, like patients looking for a feature they like on a person. They like the overall person, and they can't tell that feature is not it. It's kind of how it is. If you have an etched abdomen, but your thighs, your calves, your delts, and your biceps aren't edged, you look, and your pecs, you look weird, right? Because you
Mhm.
expect someone with muscle definition to have that all over their body. And so it's just not a procedure
Like,
that.
which of these things doesn't go with the others, right?
Yeah, I always tell the story. I think I might have told you on the last time we talked about it. I had a patient when I lived where I worked at a different practice who was an MMA fighter with very low body fat at the time and had this done, and it looked decent. And he had only gained a very small amount of weight after he retired. I mean, it was like between 5 and 10 pounds, and it looked insane, the etching. Like he
Good.
had these little tufts of fat over his rectus, and I actually liposuctioned it down
That's
to.
probably hard to do, right? To
And
correct.
it's hard to correct, and it looked insane. And sure, I mean, he showed me photos of when he had it done, and it did look good
Good.
at the time. But it's just another procedure where you have to ask yourself, how is this going to age? Is it worth maybe a year or two of looking good and trying to keep your body fat at whatever very low level it was at the time? And I think for the
Mhm.
average patient, no. Minor things are great. Like I think, some people just have, you can do just the line right in the middle.
Article.
Sometimes can look good.
Mhm.
Sometimes with men, you can do a little liposuction and fat grafting in the chest and really help with pec prominence. I mean, there's some nice little subtle things you can do if you really have one area that's just disproportionate with the rest of your body. But if you're trying to create a muscular physique that doesn't really belong to you, it looks like it doesn't belong to you. Everybody
Yeah.
kind of can see that. So I'm not a fan of it. There's some people in town that do it and they charge just absurd amounts of money. And the photos, the befores and afters they show are 100% of the time immediate post-ops. You never see people far out. And there's a reason.
Right. And they're oiled and they have the right light, the right lighting that's casting shadows.
Right.
Yeah, no, I think it, like you said, I think it can look good short term. I think it's problematic long term, and it only looks good in a small percentage of people.
Yeah. I mean, I find it very interesting. I'll always listen to Hoyo's talk because I think it's a fascinating area. And if you're going to do it, going to someone who does it a lot and is going to
Sure.
be very honest with you about whether you're the right candidate for it is key for this type of thing.
Okay, how about, do you have people coming in to see you complaining about their knees, wanting a knee lift?
Yeah, that's very common. I see that all the time.
Or do-
Knees drive. There's a population of women that are driven nuts by their knees, and it's the little fat pad medially and the skin laxity right above the knee.
Yeah, so the fat pad medially, I feel like is a lot more fibrous
Mhm.
than other areas of fat. And so I think that that is why it tends to be a little more resistant to diet and exercise, just like the people that get that little like buffalo hump type thing,
Right.
where that's definitely also more fibrous fat and again, more resistant. But yeah, that little medial pad on the inside of your knee. Yes, people hate it. I think the hard part, like that part's not super hard to address. The hard part is the laxity above the knees. I think that's really challenging.
Yeah, I always tell people, I mean, the problem with our bodies, which is the good thing about our bodies, is that they move. And so you can tighten things up, like tighten abdomens and tighten right above the knee, but the reality is that your joints move and stretch that skin and things stretch out with time. And we lose collagen and elastin as we age. And it's a bit of a chasing your tail type battle to have constant taut skin in that area. It's just
Mhm.
not really an achievable goal long term. You can make it better, but it's gonna get re-crepey with time.
What treatments do you like to do for the knee then,
I
other
mean,
than the lipo to the medial knee?
I would say in my patient population, I see a lot of ladies who were very misbehaved in the sun in their youth. And so
Um,
there's a lot of bad skin and the
Solar
laxity.
elastosis.
Yeah, so I try to focus to start on improving their skin in the area. So, whether it's radio frequency microneedling, resurfacing, dilute Sculptra, what's the new one? Skin Vive, things like that, just to improve the overall appearance of the skin in that area. I have not moved into the world of convincing patients to do a knee lift, which I know is becoming more popular because the scar is pathognomonic for what you've done and it's visible. And in LA, people are in shorts and skirts and bathing suits year round. And so the scar is not something that's tolerable here, but maybe places where people are not, it might be more common. But I see it talked about in our plastics groups that it's becoming more and more common.
Um, Not here. I mean, the only people I've done it for are people that almost have like knee panises, right? Where you've lost so
Yeah,
much
that
weight.
makes sense.
Yeah. And in those situations, I feel like it's justifiable, but Otherwise, it's very much a lateral move in my assessment of the situation in that, okay, sure, you got rid of the lax, creepy skin, but now you have a scar that says to everyone, I had a knee lift.
Right.
And it's just meh, I wouldn't do it. But in general, I feel like it's a tough area. The same things that you were suggesting, like microneedling, laser, adding some volume to fill up some of the laxity, even the body tight, but none of them is a home run for
No.
sure.
And
So
they require maintenance. They're not a one and done. So even if you get decent results, you have to keep at it to maintain it.
I would say that's true about almost the entire upper leg in general.
Right.
The leg is tough. I mean, you can get some really nice lifts by pulling up on the anterior thighs or the buttocks and like in an abdominoplasty or a torsoplasty. Even the limited medial thigh lift where you're just putting the incision along the groin crease, it only gets really the upper third of your leg. And so by the time you're at the knee, meh, does nothing. People that have massive weight loss that have that full incision, inverted hockey stick incision running along their leg for their medial thigh.
Right.
That doesn't do a lot for the knee either, actually. It's a tough area.
Very tough. And you cross a joint. So if you extend that medial thigh incision down far enough to address the skin there, you're crossing a joint, which is always problematic for healing and scars. And,
Tightening
it's
and flexibility and restriction, right? No, it's that.
complicated.
Yeah, so like you said, I would just do minimally invasive stuff to try to make the skin quality better. People notice the results, but they're subtle.
Yeah.
They're
Just
they're
depends
not
on
dramatic.
what your goal is. I think most people that come in that are really bothered by it are happy with a subtle result. So
Yeah,
it's worth doing.
sure. Okay, this one I think seems totally insane, but people that try to change the color of their irises where they're getting tattoos.
It's hit the mainstream the last couple weeks. It's been in some of the big, I think the Wall Street Journal had a story about it. There's a girl who did it and it went bad on TikTok that went viral as well. This
Is
beautiful girl.
she blind in one eye or what?
I'm not exactly sure. I just saw her video pop. I actually saved it to look at it for later, but because someone told me about it. Yeah, it's just, your your eyes, guys.
Like
It's
they're tattooing the cornea, it looks like. Is
yeah.
that what you understand too? So they're
Well,
just
there's also
not
implant.
tattooing the iris.
So this
What?
woman had an implantable lens
Mm.
that was colored. So they actually did an implant in her. And so I'm not sure exactly what happened with it, but I saw her briefly because I scrolled through it really quick that there was some redness and it looks like they had to be removed. And now she has a permanent scar on her cornea. Maybe in the future, this may be something I would definitely not tattoo, but maybe in the future, this may be something that's safer and more commonly done. But it just sure doesn't seem like my mom's an ophthalmologist and she's not a fan, as most
Oh.
ophthalmologists would agree.
Well, because the room for error is zero.
It's your
It's your
eyes.
vision, right?
Yeah, it's your eyes.
Unacceptable. Like, let's say, if your nipple doesn't survive a breast lift, like, yeah, you're super bummed, but your life is still fine. If you lose vision in one or both eyes, that's a big, big problem. Some of the ones I saw looks like they were tattooing the actual cornea. And so it looked like there was just ink on the surface of the cornea. And it looked like a weird, like when you looked up close, like almost like a computer generated like QR code. Like if you looked really close, there was like a bunch of little colored spots.
Yeah.
Uh, Pass. Sounds
Yeah. I
dangerous.
mean, the colored contacts even still, they look so much better, but they still don't look real. Like you see people and you're like, that's not her
It's
real
because
eye.
people will get purple eyes or like that bright teal color.
Yeah. I'm gonna do that. Just wait. Next time we film, I'm gonna have
Or
some.
teal. I don't
Yeah.
think they show up that well on brown eyes.
No, I mean, and my eyes are relatively light brown, so I mean, maybe I could try some of the hazel or something, but I think if your eyes are not already pretty light, it's hard to get them to look normal.
I think if you had like some of the costume contacts where it's like, yellow snake eyes or zombie eyes, I think those work pretty well on brown eyes. So you have to wear like opaque white.
Those will help me with my consult booking rates, I think, if I wear snake eyes to my consults.
Just like
My
vertical slits for irises.
my God, I know I can't do contacts at a baseline, so it's never gonna happen. But if I did do contacts, maybe I would try them.
I was Medusa the other year for Halloween and I thought about getting those snake-eyed contacts just for fun, but then I thought, nah, I don't want those.
Scary.
I was ordering them from somewhere in Russia, like they probably were contaminated with amoeba. I don't know. I don't want to put this
They're
in my
full of
eyes.
mercury or something.
Yeah,
Topical
like
mercury.
amoeba and mercury. So I would just go blind. So I'm like, it's not worth it. So yeah, I'm like hesitant to put in sketchy contacts, let alone tattoo my cornea and or
Right.
iris. So, all right. Any other unique requests you've had?
Trying to think of anything weird I've had recently. I think the one thing that we don't see a lot in the United States, but I've had a few patients that had it done in Korea, is forehead implants. Because
Oh, okay.
yeah, apparently it's very popular. At least I have 3 patients that have told me it's very popular in Korea, where you add more volume to the forehead, so you have less of a slope and more kind of, trying to think of how to describe it in a way, more
So
prominent.
their forehead is like from the side is sloping back too far?
Yeah, so they want it to be more up this way. So I
Okay.
had one patient who had it placed and had a bunch of complications and had to have it removed. But yeah, I thought that was interesting. And I've never had a request or had someone interested here, but apparently it's more common there. At least this is what I'm
Yeah.
told by my patients that were actually from Korea that have are
Yeah. I
United
wonder
States.
how much volume they occupy. I mean, like you could just
I
do
would
like a
love to see
right?
one. You know, if you examine them, they feel a lot like a pectus implant. Like
For
they feel
sure.
like custom implants. That's how it feels. But
Hmm.
I'm just envisioning it slipping and like getting your supraorbital and supratrochlear nerves or something and causing chronic pain. But I
Well,
mean,
they
it's,
must like drill them in right up here, right? They
I
must.
would hope. I mean, I don't know. I've never seen them placed. I couldn't feel where the incision was, any type of fixation, but you may not be able to feel it depending on how deeply they did it. So I don't know.
Yeah. And did you? So did they look better? Were you impressed?
I mean, they look different. I thought they were beautiful girls. One of them showed me, like, she had her actual befores and afters, not just selfies that she had from her surgeon. And she was a beautiful girl before. It just was a different look for her.
Okay. Yeah,
And
I'm not anti that, but I don't know enough about it.
yeah, I find Korea really interesting for plastic surgery. I think they're
Like they're the
accepting of
highest
it.
per capita plastic surgery
Yeah,
country,
they're
right?
much more accepting than the United States, and they are, obviously massive innovators with a lot of things. So skincare included. So it's interesting to see what comes out of Korea to see if any of it will trickle to the United States.
I don't know if it's still true, but there was a trend to have a more westernized look, right? So more dorsal height, recreating that eyelid fold. Yeah, I don't know about the forehead part.
I'll see if I can find something. I'll send it to you on it. I think it's an interesting world. I would love to go over to Korea because I know they have freestanding plastic surgery hospitals. That's all they do. I would love to go and just spend a couple days and see what their surgeons do. It's fascinating.
Yeah, it would be cool. I'm trying to think if I have any other unusual requests. I think that's about it. Other than, I think I already told you the story about the guy who was a heterosexual guy who wanted breast implants. Like he wasn't trying to identify as not a man. He
I
just
had a
wanted,
patient like that in Kansas, actually. That was a very cis man, and he
yeah,
was single and was a long haul truck driver, and he came in asking for breast implants. And I'm like, that's interesting. I've never had that request before.
yeah. And I just, did you end up doing the surgery?
No, I did not.
Yeah.
For a
I
variety of reasons. He was also a very heavy smoker, so
So that's unusual. Obviously, the whole trans surgery issue is another topic that we've touched on before, but that's one issue where it's someone who's trying to recreate their gender to be something else, but someone who wants to be essentially like a mixed gender human, right?
like non-binary too. I've had this has been an interesting journey for me, and it's definitely changed how I communicate with breast reduction patients because I've now had several patients that came in for a breast reduction, and we did a breast reduction, and they ended up wanting to convert to top surgery. And it
Okay.
feels to me like a failure on my part because I feel like I didn't get from them what they actually wanted. But both of the patients that I've had this happen have both been like, well, I didn't know what I wanted at the time. Like I couldn't
Oh,
see past my large breasts until they were smaller. And then I was like, oh, this is what I want. So my verbiage now with people, especially when they say, make me as small as possible, I ask them what
mhm.
their aesthetic is. Is it a flat chest, a small female breast, or a male appearing chest? And so that sometimes helps me figure things out because you just don't know what people want. And gender is so fluid these days that people have so many different ideas of how want their bodies to look.
Yeah.
I think it's important that we get down the appropriate path with them to figure out how they want their chest to look.
Obviously, there's some kind of issue thinking that whatever is on the inside isn't matching with what you're seeing on the
Sure.
outside. And so to say that the problem is that the outside needs to be surgically adjusted to meet the current sense of what's on the inside, I don't know. The data to support that long-term plan is questionable, right?
There's no
You could
data
also,
for non-binary patients.
what's
So
that?
there's no data for
Oh,
non-binary.
sure. Well, yeah, but I just meant in general. Like it's a surgery that the popularity has obviously significantly increased, and there's just the data hasn't followed. There's not enough data yet. So I'm hesitant to do those kinds of surgeries. But then again, it's like, for example, I had a patient who identified as gender neutral, and she had huge breasts, and I can't remember what size they were, but just so big. And I was talking to her about the traditional breast lift scars and patterns and how we reposition the nipple and areola. And she said to me that, she doesn't care about the nipple and areola and she doesn't want them. And um, and I was kind of like, well, yeah, I mean, it is a lot more effort to maintain that. And it does
Right.
give you a lot more scars and it is higher risk. Um, so I ended up, with after talking to her therapist, end up doing basically like almost not a top surgery, but kind of like that, where she just wanted the tiniest mound. She didn't even want a nipple and areola, which is just like a human type feature.
Right.
It's weird. It's one of those. I think sometimes find yourself in this area where the difference between right and wrong is very difficult to.
Well, I think there's obviously a lot of politics that gets around it. I mean, I would argue that there's nothing more wrong about that than putting 1,000 cc implant in someone, right?
No, yeah, I mean, but it's like why,
Yeah.
like on the other hand, why, to demand that someone has a wise pattern chest incision, right, with
Right.
the risk of nipple death and all the scars when they don't care about it and they don't want it. Like it's
Yeah,
also
I
like
mean,
that doesn't make sense either,
it's like,
right?
I mean, there's all these things where I think a lot of it's societal norms and we're just used to being asked certain things and all of a sudden we're being asked different things and it feels weird, but it doesn't necessarily mean it's wrong. But I agree. I think you just have to make sure that people are well educated and that they're
Yeah.
appropriate age and know exactly what they're signing up for and it's clear. I mean, I've had a few breast reconstruction patients who wanted to have their nipples removed that didn't need to have them removed, not from cancer fear, they just didn't want them anymore. It always feels so weird because you're so used to like saving the
Like, should
nipples.
I be doing this?
Yeah, and then all of a sudden someone's like, nah, get rid of it, and it just feels a little
Yeah.
bit strange. But there's
Yeah.
nothing more wrong about that than some of the other things. I think that's the thing about
Yeah.
plastic surgery is nothing we're doing is needed really. I mean, it's nice for people and it's psychologically beneficial, but most people don't need what we're doing. So figuring out whether we're doing something that will enhance their life or unfortunately not enhance their life is important, just like when we're saying subjective versus objective things.
Absolutely. And that's one of the things about each plastic surgeon. Like everyone has their own practice and their own areas of expertise and things that they are or are not comfortable doing. So
Right.
I think that that's good. No one wants to be forced to do a surgery they don't want to do, and no patient should have to do a surgery that they don't want to do. I don't
Yeah.
want to operate on someone that doesn't want to have something done. That's great. That's terrible.
Yeah, it would seem terrible. And your surgeon should be your advocate throughout the process and should at least try to understand what you're trying to get out of it.
Yeah, I would hope so. But yeah, there's a right surgeon for some people and a wrong surgeon for some people. I think you have to do your due diligence and find the right match for you. And depending on what your interests and goals are, you're going to be led towards different surgeons. The incels towards one person.
I don't know
The
interacting with cells.
all the things that we talked about today, there are surgeons that will do them. That's why
Well,
those
there's
are
someone who I always tell people if you wave a credit card around, there'll be somebody who will grab it. So
yeah. So all of these things can be done. Some of the more unusual things, you'll probably have to put more effort into finding someone to do it. But like you said, for the right amount of money, you can convince a fair amount of people to do things they may not ordinarily do. So yeah. It's the way of the world. Money talks.
Unfortunately.
All right. Well, thanks. That was interesting.
Yeah, cool subject.